Good afternoon, everyone. We will get started in just a minute here. Before we do get started, I'm going to give everybody else a couple minutes to join. In the meantime, I'll remind everyone that you are muted when you come into the webcast here. And if you could please use the Q&A panel to submit questions during the presentation. I'll try to get to those at the end of the presentation if we have time. Thanks. All right, so we're going to get started here. Once again, I just want to remind everyone that you are muted. And if you could please use that Q&A panel during the presentation to ask any questions that you may have. I'm going to try and get to those at the end of the presentation if I do have time to do so. To begin with, I want to talk a little bit about Galen Healthcare Solutions, who we are, what we do, and I want to remind everyone that we are going to be at HIMSS from February 19th through the 23rd in sunny Orlando, Florida, and we are in booth number 4448. So if you or someone from your team is planning on attending HIMSS, definitely come and visit us. Again, that's booth number 4448. So as far as Galen Healthcare Solutions, we were founded in 2005. We're currently ranked the best in class for health information technology implementation, staffing, and support. And we rank pretty high in class in a few of the other categories as well. Our average healthcare IT staff experience at Galen is 12 years. So we have a pretty wide depth of knowledge across everyone that works here at Galen. We do work with a lot of different vendors at Galen here, especially for the conversions and migrations that we take part in. So you can see all of the different vendors that we work with on the screen. As far as what our value proposition is, we look to transform data into actionable, profitable information for you. We provide world-class technical and professional services to healthcare organizations that interoperate, aggregate, convert, harvest, and optimize clinical patient information within your multi-vendor systems portfolio, including PM system, your EMR, and also HIE. And we deliver a suite of fully integrated products that enhance, automate, and simplify the access and use of clinical patient data within those systems to improve cost efficiency and quality outcomes. As far as myself, my name is Joe Neary. I'm the lead software engineer here at Galen on the DevOps team. We're a division of the development team. Before I took on this role, I was a software engineer on the development team for about 3 years. And prior to that, I was a member of the technical team also for about 3 years, starting off in upgrades. Started off doing 11.1.7 and V10 to 11.2 upgrades for the Allscripts TouchWorks EMR. So I have a pretty wide background here at Galen, and I'm excited to bring a lot to the team on the DevOps team in my new role. As far as today's presentation goes, I'm going to be talking about business continuity planning, documentation during the EMR downtime, and some of the topics that we'll be covering today include the difference between business continuity and disaster recovery. I'm going to go into a little bit of a high-level overview of each, talk about some terminology, and also we'll have a focus on considerations and consequences surrounding EMR downtime, and also what we can do to prevent and help mitigate downtime when it does occur. To start off with, I want to kind of start at the beginning of everyone's EMR journey here and talk about the differences between paper charts and EMRs. I'll definitely keep this brief here, but this is definitely relevant to this presentation because EMRs have some differences when compared to paper charts when we're talking about business continuity and disaster recovery. For example, if your internet or network goes out, you're going to have a hard time using most EMRs. But with a paper chart, if you lose your internet, there's going to be little to no effect there. In addition, with paper charts, there's no reliance on software. So when you do involve software, there's always the possibility that it breaks down. There's also licensing fees for software, so that's another benefit to paper. Also, charts are centrally located, so that can be a downfall, though, because you don't typically make backups of paper charts. So if you're having some sort of disaster event that actually does affect the paper charts, those paper charts are going to be lost forever, unless you've archived them in some way. With the EMR, though, there's a lot of different benefits to the EMR, except there are some downfalls when it comes to business continuity. I already mentioned some of them. Some additional downfalls, there's the learning curve. You need to learn the new EMR software, and not only that, but when you take on a new version of the EMR, the vendor's always introducing new features or changing the UI or something. So there's always something new to learn with the EMR when compared to paper, whereas the paper charts didn't change all that much. So what I want to do here is just throw up a quick poll, Justin, if you could. And this poll is just asking essentially when your most recent downtime was. Oh, sorry, Justin, we got the wrong poll. There we go. Was it within the last 60 days, the last 6 months, the last year, the last 18 months? Has it been longer than that? And also that last response also includes the never category. So I'm going to leave this up for just a moment, and then we can take a look at the results. All right, it looks like we have most of the responses in. And it looks like we're about evenly split here between the last 60 days and the last 6 months. So it's relatively recent. We do have a couple in the last 18 months or longer than 18 months. And there's also a few in the last year. So it definitely looks like a good proportion of our audience here has been affected by some downtime events in the recent history. And one thing that we'll get into later in the presentation is some things that you might not necessarily consider to be downtime, but really are when you talk about your providers and the ability for them to be able to use the EMR. So things like maintenance or upgrades. Really, you may not consider that to be downtime, but providers aren't able to use the EMR to its full extent. So we'll get to that in a little bit here. But to move on back to our presentation, let's talk about the difference between business continuity and disaster recovery. So business continuity is really a business and people-centric subset, or rather umbrella term that we talk about when we're talking about the whole disaster recovery, business continuity topics. So it really has to do with how your business runs and who's doing what and how are you going to continue to meet your business objective during an interruption to your workflow. Any interruption to the workflow is what we're going to consider to be a disaster for today's presentation purposes. Whereas disaster recovery is really focused on the technology infrastructure, and it's really a subset of the business continuity plan. So inside your business continuity plan, you would have your disaster recovery plan. It's much more data-centric, so it is purely technology-focused, and it definitely involves all of the procedural elements surrounding replicating, storing, recovering, and restoring that data in the event of a disaster. Now, when we talk about disasters, there's a couple of different categories of disasters, and it's definitely important to understand each of these, especially because there's some things that you may not consider to be disasters, which really are, and it's important that when you're doing your disaster planning that you incorporate all of these different types of disasters into that planning process. The first one on the list here, as you can see, is a data integrity problem. So what do I mean there? What I mean is one or more patient records are either updated incorrectly or just flat out deleted. This could be the result of hacking or some sort of data corruption. It could be an issue with an upgrade that perhaps the vendor told you that the upgrade went through properly, but then a week or two later you realize that there's some element that's missing or has been corrupted. That type of event is a data integrity problem. The next type is a data availability problem. So this is what we would consider traditionally to be downtime. So it could be as simple as your EMR is down, or one of the servers in your EMR server farm is down. Perhaps it's your network that's down, or a particular PC, or your site lost power. It could also be some sort of ransomware, which is topical these days, where some hacker is holding your data for ransom and you're not able to even get into your PC or EMR until you pay out that ransom. So all of those are data availability problems where you won't even be able to get into the EMR. Next, we have an environmental problem. So in that category, we have natural disasters. It could be something else that's preventing you from getting into the office, such as a hazardous material spill, or it could be that it's 110 degrees out and your AC is out. So there's a couple of different subcategories in the environmental problem category. Could also be a personnel problem. So a good example there is a loss of vital knowledge. So what I mean is some sort of knowledge that a particular staff member would have that wasn't passed along for whatever reason. It could be that the staff member quit, or the staff member is in the hospital or something like that, and they have some sort of piece of vital knowledge, such as the master password for some aspect of your system. And if you don't have that, that could certainly be a disaster. And finally, the last category here is a privacy problem. So that would include loss of data for one reason or another, and not properly tracking it. It could also include an event such as not properly wiping a hard drive, and then disposing of the hard drive and someone recovering PHI off of that hard drive. We hear a lot about laptops being lost or stolen. Provider took it home with them, left it in the car, or an employee, and the car was broken into and the laptop is stolen. And hacking would also fall at times under this category as well. So all of these items, or events rather, could be disasters, and these are the 5 categories that most of those events are going to slot into. Some other important variables when we're talking about defining a disaster are duration, severity, patient scope, and physical scope. So let's take a brief tour through each one of these. Duration is essentially, if nothing changes with the state of the disaster, how long is it going to be until we're able to continue with our business, which for most of the audience on the phone today is going to be seeing and treating patients. So really, if nothing changes, when are we going to be able to see patients again? Severity, how severe is this disaster, and what is the possibility that it's actually going to get worse? So if it's a minor, if the scope is minor, it's not that severe of a problem, then perhaps we can still see patients, and we just need to make some minor changes, like closing off one exam room, and we can see patients in the other exam rooms. Patient scope. Is this disaster going to affect all patients, or is it just a subset of the patients? For example, perhaps it's just one of your sites that's down, but your other sites are still up. So you can maybe contact those patients and have them seen at another site. And then physical scope. Is the disaster limited to a certain location or area within a particular location, or is it affecting all areas of your business? So I kind of touched on that as well with my examples. Next we're going to do another poll here. And Justin, if you could, what was the duration of your most recent downtime? So I tried to put a good range out there to kind of recognize the fact that most downtime is going to be rather brief. I think it would be somewhat unusual to have downtime greater than 24 hours for most groups, at least. So let's see what the polls come out like here. All right, it looks like most everyone is in, and by far the most popular choice was less than 6 hours. So that's not horrible, right? But it depends on what your SLA or service level agreement is with your organization. If 6 hours is an acceptable amount of time, especially if it's during off hours, then that may be okay. But I think we're all trying to shoot for having less downtime. So it's definitely something that we can discuss a little bit later here in the presentation. All right, so next we're going to talk about the potential repercussions of disasters. And there's a lot of different ones that you may not really be thinking about. Primarily, or primary in the mind of most people is probably the financial consequences, right? The most obvious thing is that you won't be able to see patients or accurately treat the patients, and that's going to cost your organization money. I watched a recent presentation that Dan Morielli was on, who's the CIO of Hunterdon Health System, and they were able to calculate their downtime costs to $160 per minute. So as you can imagine, if you have a 6-hour downtime event, it's going to be quite a lot of cost there directly to your organization. And then one of the other figures that is referenced a lot is the 1 hour of software downtime costing a practice almost $500 per physician. I am going to talk about how we can calculate this amount out so that your organization can take that into consideration. But these are a couple of the examples that I wanted to provide. And it's important not only to consider that direct financial loss, but there's other types of financial loss that can happen as a result of a disaster. For example, the cost of data recovery. Let's say that your SAN fails and you don't have a backup of that data anywhere. You're probably going to want to try and recover that data off the SAN, and that's going to be a cost. It's going to be a significant cost, first of all, but also it may not be a cost that you really factored in. So it's important to consider that. Also the loss of future income. If your downtime is significant enough or your disaster is well publicized, perhaps patients are going to make the decision to see, to be seen at a different practice. So that would be loss of future income. Also, there may be HIPAA privacy violation penalties, with that stolen laptop or some sort of other PHI leak. And those have actually become even greater after HITECH went into effect. And then the final one that I have here is litigation costs. So there may be some sorts of litigation involved or lawsuits involved with your downtime. So it's definitely important to consider all of those consequences and try and avoid downtime and disasters whenever possible. A couple of other consequences that you may not have been thinking about would be patient trust. I did touch on this a little bit on the last slide, but these disaster events could be highly publicized. So that stigma of those privacy violations, especially now that they're published online on the government's website, for everyone to see, it may be, that may result in patients wanting to see a different practice. And you also may have patients being turned away from the office visit because of the downtime. So that's one other aspect of patient trust. And as far as patient safety goes, if your system is down, it's going to be very difficult for you to provide accurate, quality patient care. And I think everyone on the phone can agree that that's one of our goals is to provide always accurate, quality patient care. So that becomes very difficult when you can't see the patient's history, view their lab results, and all that. So let's circle back to how we calculate the cost of downtime. I know this is very small, and I'm not going to go through all of this today. This is really for you guys to take away from the presentation afterwards. We'll get the slides mailed out to you, or emailed out to you rather, and you can use this to calculate what 1% downtime would be. On the flip side to having 1% downtime would be 99% uptime, really. And you can vary the SLA to be 99.9% uptime. But in some of the research I was doing for this presentation, I found that some EHRs consider all the way down to 96% uptime to be acceptable in their contract with the EMR vendor. So that's actually a lot of downtime, and that could have a very significant amount of impact on your organization. So this formula will allow you to calculate what the costs of those downtime are. And again, you can modify it to suit whatever uptime you want to analyze. Okay, so how do we actually go ahead and define a business continuity plan? Well, first, let's talk about what a business continuity plan is. As you can see there, it's the procedures that are allowing you to continue your business, which for most of us is going to be continuing to see patients. It really goes through the who, what, where, when, and why of your procedures. And to harken back to what I was talking about earlier, it's really, we're talking about people-centric items here, not data-centric items. That's in the disaster recovery plan. One thing I did want to focus on is that it's very important as a part of your business continuity plan to maintain that plan, test it, and update it frequently. So that's the business continuity plan. Very brief summary here. One aspect of your business continuity plan is going to be a HIPAA security risk assessment, or SRA. And this is actually defined in the HIPAA security rule in the sections that you can see there on the screen. It talks about the administrative safeguards, physical, and technical safeguards. So let's talk briefly about what a HIPAA risk analysis entails. The objective of it really is to document the vulnerabilities to the confidentiality, integrity, and or availability of PHI, and determine what appropriate safeguards need to be in place to bring the level of risk to an acceptable and manageable level. It's very important to identify what data your organization needs to protect, and where that data is at rest and where it goes in motion. And then that will allow you to provide the basis for your security policies, practices, and technologies that you implement to protect all of that data. When we're talking about administrative safeguards, it's the risk analysis procedures and demonstration of a risk management process, policies and procedures relevant to operational security, including business associate security requirements, information access restriction requirements and controls, incident response procedures and disaster recovery plan, and the evidence of periodic technical and non-technical reviews. So if there's any compliance officers or folks that are involved in HIPAA compliance on the line, these things should definitely sound familiar to you. As far as physical safeguards go, that's concerned with physical access controls such as building access and appropriate record keeping, policies and procedures for workstation security, and the proper usage, storage, and disposal of data storage devices, which I mentioned earlier when I was talking about properly destroying hard drives. And finally, technical safeguards include auditing and audit procedures, the use of encryption devices and tools, and implementation of technology to ensure PHI confidentiality, integrity, and availability. A disaster recovery plan is typically going to begin with a business impact analysis. The business impact analysis is the foundation of any good disaster recovery plan, and it complements the risk assessment by utilizing the information generated during that process. The main difference between these analyses is that the HIPAA risk assessment focuses on data security and potential adverse effects, while the business impact analysis focuses directly on the operational impacts to the business. The BIA reviews what losses you're going to incur if the system goes down, and the importance of each downed application is ranked from highest to lowest, along with the financial impact to each. It's also important in your disaster recovery plan to identify and define potential disasters. I hope that some of the earlier slides will help you do that. And the goal here is to prevent the disaster from happening, first of all, and minimize the opportunity for disasters. Also to prepare for the disasters, because we know that we can't avoid all disasters, right? There's nothing that we can do to prevent an earthquake, at least right now in time. So it's important to ensure that all resources are available to cope with and recover from the disaster, again, as you can't prevent all disasters. Coping with downtime involves the operating procedure for downtime and the business continuity plan. So it's really laying out the workflows of what to do in each event, each downtime event. And finally, recovering from the disaster. So once the disaster is over, how do you go back to and resume normal operation? So let's get into how we actually take care of handling patient care during a downtime by talking about defining and documenting workflows. So if the patient records are electronic, it's an important consideration as far as if we want to see patients when the EMR is down, how are we taking that patient history? How are we taking those active problems down, the medications, you know, their recent history when the EHR is down? It's not easy when you're used to documenting everything in the electronic medical record. It's down. So do we go to paper? You know, I'll discuss those different options on the next slide. If the network's down, how do we even know what the schedule is for the day? So that's certainly a good point, right? Perhaps you want to print the schedule out at the beginning of each day, and if you do have same-day schedules, you know, you could pencil them in. But you know, it's what I'm trying to stress here is that you need to come up with a plan for these types of events, because not all of these should really prevent you from being able to see patients. You guys, organizations should be able to react to these and not bear those consequences of the disaster. At least try and mitigate them as much as possible. What happens when the issue is resolved and the EHR is available again? I think we talked about that a bit already. How are walk-ins handled? Great question, right? What do you do if the patient comes right in? It's hard to validate their insurance when your medical records system is down. So how do you handle that type of situation? And what do we do about prescriptions, labs, and order recs? Some groups probably are still doing lab and order recs but on paper, and it may be that you have those types of things in-house, so you just do those on paper, and you know, the patient walks over there and gets that stuff done. But if it's done electronically, well, what do we do when the interfaces are down and the EMR is down? Definitely important things to think about. And so when we are documenting during the downtime, what do we do when it comes back up? So there's really, well, sorry, when we are down, how do we document that visit? There's two different options, really. We can go to paper, or we can do it electronically somehow. But if it's the network that's down, how do we do that? Well, you could have some sort of application that lives just on the PC, and that is able to send the data back into the EMR when the EMR comes up, or perhaps that's just the way that you're recording the documentation is on the PC, and when the EMR comes back up, it needs to be input back into the EMR manually. Either way, that's one option for electronic documentation. If we're going to be talking about paper forms, well, most groups probably aren't using them all that frequently anymore. Back in the day, they used to be in the filing cabinets everywhere. Everyone knew exactly where they were. There were the trays. Everybody took the papers out of there. Very easy, second nature. But these days, if everybody's using the EMR and are very used to it, do we even know where those forms are anymore? Who's maintaining the stock levels? And if everything's on paper, what do we do when the EMR comes back up? I know that a lot of groups that we work with, at least for the TouchWorks EMR, would document on paper and then scan that back into the EMR. Well, that's great for getting the data back in, but that's still not going to be in a discrete form. Someone still needs to go in, add the active problems, add the medications that were prescribed, that type of stuff back into the EMR. So all of that disorganization can lead to not only staff stress levels, but also patient stress. So it touches back onto the effect of the disaster back on the patient. So how do we actually deal with these? There's got to be some solutions for this, right? Well, there are. A few of these are pretty common, at least from our TouchWorks clients. So allow me to just speak to my TouchWorks experience for a moment when I'm talking about high availability. So most TouchWorks clients are going to be in at least partially a high availability situation, which is really a preventative measure for trying to prevent a disaster from happening, in that they have clustered servers. So most clients are going to have a clustered database server. And for those non-technical people on the phone, what that means is that there's two servers available. One is an active server, the other is a passive server. And if something were to happen with the active server, the passive server takes over, and it is mostly seamless, although with TouchWorks it's not truly seamless. But better than not having a database server at all, I'm sure we could agree. Most clients are going to have a server farm, at least for your web servers. So there's very few TouchWorks clients that have one web server. I can think of one client off the top of my head, but most are going to have more. Some clients have 20 or 30 web servers. And although you may consider that primarily to be a method to deal with the large amount of user load on the system, it's also a high availability solution as well, because if one web server goes down, it should seamlessly accommodate those users on the other web server, at least temporarily. So high availability is one aspect of a disaster recovery solution in that it's mostly preventative. Virtualization is another great solution that can be used in a couple of different ways. It's good for preventing issues, but it also helps with mitigation, because you have a lot more flexibility when we're talking about virtualized environments. It's much easier to spin up new servers, right? You don't need to order a server, bring it in, get it all wired up. Your VM host probably has room to spin up a VM very quickly and get that up and running if need be. Also, a lot of the VM solutions have the ability to kind of move back and forth across a variety of hosts. So perhaps you have two different host servers where the VMs can float in between them, whereby if something happens with the one host, the other host can take over and run those VMs seamlessly. There's a couple of other strategies that can be used with VMs to help mitigate disasters, but those are the primary ones. Read-only environments are a great solution, but they really only are good for temporary outages. Most clients that we work with use those during TouchWorks upgrades. So if TouchWorks or your EMR is going through some sort of upgrade, you can make your EMR still available to your users, but they won't be able to write to it. It's really only to read, and some folks call it view only, read only, same thing. And it would be very difficult to be able to write to the environment while the upgrade is going on, because the upgrade is changing the structure of the data. So you couldn't really fail over to a DR environment while your primary environment is being upgraded, at least with the EMRs that I've worked with. So read-only is good. It's a good step in the right direction, but it is definitely limited in its scope. In addition, depending on the way that you've structured it, there may be some downtime before you can get that read-only environment up. If you're, it really depends on where it's being hosted as far as the database server location and whether there's any replication that's been going on to get over to that. But we'll talk a little bit more about the methods there in the next section, which is a DR environment. So most of the time when we talk about a DR environment with most clients that have implemented one, it's a full one-to-one hot site DR environment. But it doesn't need to necessarily be that way. Let's say you have 20 servers in live, there's 20 web servers in live, and you only have 5 web servers in DR. That may be okay. It's going to run a lot slower for your users, but if that's acceptable under your SLA, then go for it. It's going to save you certainly a lot of money for those servers that are just sitting there most of the time, not even being used. So that's another downside to DR, is that it's very expensive to maintain, especially if you're doing true one-to-one where you have an exact duplicate of your SAN that just sits there and receives data all day long, and no one actually uses it. That's an extremely expensive cost. But again, there's all sorts of different levels. Hot site, in case you're not familiar with the terminology, is a fully equipped data center with servers that can be online within hours. Typically, it's one-to-one duplicated and is by far the most expensive option. Contrast that with a warm site, which is going to provide basic infrastructure and functionality, but is also going to require some lead time to get the servers up and running. For example, they may always be turned off, and they only take, a weekly full backup is restored, but during DR you would need to restore your daily differentials and then your log backups and all that good stuff, and it could take some time to get everything up and running. That could be considered a warm site. And a cold site is the least expensive, but it's also going to take the most time. And a cold site is a secure standby location with no equipment or data whatsoever. The equipment must be brought in and configured, and it could take up to a month to be operational. So it is wired for electricity and networking, but there's really nothing else there. So that's a cold site. And it could be that you have a combination of one or more of these. But one popular product that we've seen being used for DR environments, for software-based replication at least, is a product like Zerto. There's a few others out there, but it essentially is going to copy your VMs over. I think it probably has support for physical servers too, but it copies them over to your DR environment. So in case you need to, you can flip the switch and be over at your DR environment. One additional preventative measure is a redundant WAN connection. So what I mean there is a secondary internet link to your site. So if your site is normally on 10 meg fiber connection up to the hosting data center, you may maintain, I don't know, a cable internet connection as well in case a squirrel happens to chew through your fiber line, right? It happens all the time, that type of thing. So if you have a redundant WAN, these days you can outfit your location with networking switches that can be pretty much seamless. So if your one internet line goes down, you're not without internet. You have that redundant WAN. Obviously, the downside to that is that you're maintaining 2 internet connections, only one of which is going to be used most of the time, and that can be pretty pricey. And the last one that I want to talk about is SAN replication. So I think I touched on that, at least mentioned it earlier, and that is taking everything that is done to your SAN is duplicated off to a secondary SAN somewhere. SAN is your storage area network. It's essentially an enormous hard drive apparatus. to make it a little simpler. And you know, anytime anything is written to the SAN, it gets duplicated somewhere else. So theoretically, if you pulled the power plug on your primary SAN, everything is going to be waiting for you at your secondary SAN in your DR location. So another preventative measure. So those are a few of the different disaster recovery / business continuity solutions that are out there. Whether it's DR or BC or both, really depends on which one we're talking about. But Galen actually has our own business continuity solution that is available for TouchWorks clients. And I realize that not all of the audience today is going to be TouchWorks EMR users, but I think that this is still a good opportunity for our audience today to kind of see what possibilities are out there. And our solution is called Vital Center. Vital Center allows our providers to continue to see patients in a wide variety of disaster scenarios. It supports network connection down, EHR upgrade downtime. You know, if something happens to your internet link, you can still see patients. If it's just something wrong with your EMR, you can still see patients. So it really covers all of those different scenarios. It's also transparent to patients because your providers will still be using their laptops, for example, to see patients. So your patients probably won't know that there's any difference. Where compare that to providers scrambling, trying to find out where all the paper forms are, you know, grumbling about how the EMR is down and they have to use paper. Providers can also document the visit electronically. It's really great. They can just key in all the content, and once TouchWorks comes back up, it flows straight into TouchWorks. And there you go. And this all allows the staff to continue to focus on treating patients. And by default, we provide the last 30 days of appointments and the next 5 days of appointments for the provider schedules. And the way that this actually works, let me fast forward 2 slides here, is that we maintain a Vital Center server up here. It does a nightly extract of the content from the EMR, in this case TouchWorks, and it maintains the entirety of the patient's relevant clinical content on the Vital Center server. That way, if it's just the TouchWorks server that's down, the end users can continue to retrieve patient information from the Vital Center server. And in addition to that, that scheduled chart functionality that I was talking about actually sends the patient charts out to the end user PCs. So we can literally go up to the user's PC, unplug the network card, the network cable, load Vital Center, and the providers would still be able to see patients because the patient's charts are on that PC. So how does that actually compare to some of the other solutions that are out there? Well, first of all, it's important to remember that Vital Center is a business continuity solution. Its main purpose is to allow you to continue to see patients during disaster events, whether it's your EMR that's taking an upgrade, or it could be that your networking switch at your location started on fire and you have no networking now. All of that will allow you to continue to see patients. Compare that to some of the other solutions that are out here, and you can see, for example, a hot site, as I mentioned, is extremely expensive, and it can take hours to come online, depending on your SLA. Whereas Vital Center, it's available immediately. You can actually even use it when the EMR is up. We try and ask that the users don't do that. Obviously, you want them using the EMR, but Vital Center is always available, essentially. To give a little bit more detail on the way that it works, it is the Vital Center Turmel client. It's what we call the FAT client version, so it's an actual application that's installed on the PCs. Those scheduled vital charts, that's what we call the patient chart content, automatically downloaded to the PCs. It allows the provider to continue to provide patient care, even in total and complete network downtime, as I mentioned. And it can also do on-demand requests. So how do we handle those walk-in requests? Or let's say that there's some sort of chart content that isn't included in the patient's vital chart. So the vital chart doesn't contain all of the patient's chart content. It's just the relevant portions that would be most frequently needed for patient care. And we handle those walk-ins, or if something's missing, by way of an on-demand vital chart request. And that aspect that I was talking about for the electronic documentation is called Vital Note. And finally, it's encrypted and secure, both at rest and in motion, and fully HIPAA compliant. This is what the UI looks like. You can see that there's the provider drop down on the left here. Pick the provider that you want to see their patients for. The green dates are dates that have appointments. Click onto the date. You see your schedule down here. Double click on the chart. Opens up the patient's chart, and it allows you to see the patient. We have another aspect of the solution which is actually included. That's called Vital Center Web Access. This is really good for providing coverage for PCs that don't have the Vital Center thick client installed, or perhaps you are operating on PCs that are thin client PCs, or maybe you want to deliver Vital Center via Citrix. Then this is a good option because it's just by web browser. So you navigate to the URL, log in, and you're good to go. No additional software installation or plugins for those TouchWorks folks on the line. I'm sure you're familiar with the web controls. None of that's involved here. It's just straight away you log in, you're good to go. Allows you to do all the same functionality: view the schedule, view your scheduled vital charts, scan documents, on-demand vital chart requests, and also document the visit with Vital Note. The only thing it can't do is operate in total network downtime because it's essentially a website. So if your network is out, you won't be able to pull up a website. But it's still good in TouchWorks downtime and for that gap coverage, like I mentioned. This is what the web client looks like. You can see it's fairly similar. It's just delivered in Internet Explorer. And then one final aspect of the Vital Center solution, which is really a value add for a couple of our customers that are taking really good advantage of this, is the Vital Center batch extract functionality. This allows you to submit batches of patients, up to 2,000, depending on your server size, charts in bulk, and it produces those charts simultaneously. You essentially select which aspects of the charts you want to include, and it will produce the charts for you, including merging the scans into the charts. So at the end, the scans would be appended to the end of that vital chart document. Fantastic for insurance audits, also research studies, medical records requests, and there's a little testimonial over to the right from one of our clients, Michael over at Summit Medical Group, who uses this extensively. In the first half of 2015, they did over 100,000 vital chart extracts, and they actually pretty much covered their entire cost of the Vital Center solution by making an agreement with some of the payers to save the payers costs from having to bring in people to look up the records. Instead, the client, Summit, was producing the charts and sending them over to the payers. This is basics of what it looks like. You can see the results. In this case, I submitted 40 charts and it was completed. There's a lot of different aspects to the functionality here, so it doesn't really translate all that well into a PowerPoint. But if you want more information, certainly reach out. And then the final format here, as you can see, is a bunch of PDF documents. So you could, depending on the way that the recipient wants to receive these, you can do it via secure FTP or some other method and deliver the charts to them. And the naming convention here is also customizable. So we can react to pretty much whatever you want as far as the naming convention is concerned. One additional product that I just wanted to mention real quick is something that is going to be coming out very soon, and that is Vital Center Online Archival. So this is our solution to deal with any of your products that you may be considered legacy that you've sunsetted. So let's say that you've converted from one EMR to another, and you need a way to still maintain and respond to legal requests, because typically you don't convert 100% of the content of your EMR when you do a migration. There's some aspects that aren't included. For example, you may want the last 5 years of patient data, but you've had the EMR up for longer than that, or something like that. Or you need to view audit information. Audit information is almost never included in a migration, but obviously very important for a legal request or for HIPAA purposes. So if you don't want to keep maintaining that EMR that you're no longer using, you don't want to pay those fees to the vendor, we can come in and help you implement that in an archival capability. So we'll grab all of the data. It's always encrypted, and it's available to you. Definitely reach out if you're interested in more information on that. And to wrap it up here, before I get to any questions that folks may have, why choose Galen? We have a lot of community support, so I encourage you to visit our Knowledge Center, where you can see white papers on all of our solutions and read some of our success stories. We really have a pretty big footprint in moving healthcare IT forward, and we are always looking to freely share our knowledge and our experience. There's over 622 blog posts available on our website, over 200 webinars just like this, a few of them led by me. Although it's been a few years, I apologize if I was a little rusty here today. Haven't done one in a while. But I encourage you to visit our website, galenhealthcare.com. Check that out and experience the difference with Galen. So to check out the slides from today's presentation, they will be up on our external, our public-facing wiki shortly after today's webcast, and there's also the link for our website. And I'm going to take a moment here to see if there were any questions. All right, so Brian asked, are there apps specific to electronic documentation that can be installed on workstations for documenting during downtime that can upload data into the EMR when service is restored? If so, do I have any suggestions? Honestly, I'm not 100% familiar with what is out there on the marketplace. I can, obviously I spoke to Galen's product, Vital Center, but at the moment it is specific to TouchWorks. Justin, I don't know if you have any knowledge in that space.
Yeah, I did. While the question came in, I did a quick Google search for solutions, and I didn't find anything definitive. I think the concern would be how to import that data back in while maintaining versioning. As we can appreciate, notes, there's a lot of metadata and audit data around that, especially when you consider different versions of it, and you have to maintain that integrity. So, Brian, to answer your question directly, just a quick survey didn't unearth anything with regards to an app specific to electronic documentation.
Yeah, Justin, that's a good point. I think it'll also be important to consider the encryption and other HIPAA security concerns as well. If you're let's just say you're just throwing something up onto your PC in Notepad, right? It's obviously not going to be encrypted unless you have whole disk encryption on the laptop. But still, there's downsides to whole disk encryption that Vital Center addresses. We'd love to get into if anybody's interested. But yeah, there's a variety of concerns if the tool really isn't focused on HIPAA compliance and the fact that it can contain PHI.
Yeah, and I'd follow up. It's a great question, Brian. Thank you for bringing it up. And certainly the challenge isn't it always around interoperability, but the challenge is typically around the EHR in question, its API. How do you get the data back up, and is that application compatible with the specific API? So we presented our solution, which is compatible with the Allscripts API, and there may be other vendor-specific solutions out there as well. But like I said, there's nothing generic that I was able to unearth.
All right, I don't see any other questions here, so I guess we'll wrap it up here. Thank you very much for attending today's webcast, and Justin, you'll get those slides up onto the wiki shortly after we're done here, right?
Yeah, absolutely, and I will be sure to follow up with an email to each of the attendees, and I'll provide a link to the slides and to the recording. We've been hosting these recordings on YouTube for download, so after the event you'll be able to download that if you wish to view it in the future.
Great. All right, thank you everyone, and certainly feel free to reach out to myself or Galen in general if you need anything in the future. Thanks.